The pharmacology of aspirin is what we're talking about next. I get to see that aspirin is a very, very popular drug. After Panadol, aspirin should be very, very popular. Right? Aspirin should be very, very popular. So talking about this aspirin, you get to see that another name for aspirin is what? Acetylsalicylic acid. Say it what? Acetylsalicylic acid. So talk about the pharmacology of aspirin, talking about the mechanism of action, pharmacokinetics, indications, that's disease conditions where you are using aspirin. Talk about the adverse effects and the contraindications, right? When you shouldn't use aspirin. Okay. So for the overview, we say that this aspirin is also known as what? Acetylsalicylic acid. It's a widely used medication with analgesics, antipyretics, and what anti-inflammatory properties. So analgesics that basically can relieve pain. Antipyretic, it can reduce your tendencies of vomiting. Anti-inflammatory to stop inflammation of tissues. You get that those are the properties of aspirin. So what is the mechanism of action of this drug? Aspirin works by what? Irreversibly inhibiting cyclooxygenase enzymes. Okay, especially the cyclooxygenase 1 and cyclooxygenase 2. Those are the enzymes that basically what are involved in inflammation. So if you inhibit the enzymes, it will stop inflammation, right? So this inhibition leads to a decrease in the formation of prostaglandins and thromboxane 2, right? So prostaglandins are involved in pain and inflammation. So if you inhibit the enzymes, that means what? It will solve pain and solve inflammation, right? So while this thromboxane 2 is important for platelet aggregation and what? Clot formation. So one thing is, if it is stopping thromboxane 2, that means what? It will prevent blood clotting. So another use of aspirin is using it in patients that have a tendency of their blood clotting, like in stroke patients and all of that. You get. All right. So looking at the pharmacokinetics, pharmacokinetics, that's when we look at it under what? ADME. All right. So the A is actually the absorption. So aspirin is rapidly absorbed from the stomach and intestines by what? Passive diffusion. All right. Distribution. It is widely distributed throughout the body. Metabolism. Aspirin is actually what? A prodrug, sorry. So that means it has to be converted to its active form. So when you take it now in the stomach, it is now converted into what? Salicylates. So it's converted in the stomach, in the intestines, in the blood or liver. All right. Excretion. Salicylate is primarily excreted by the kidneys. Right. So what are the indications? Well, I've spoken about the uses of the drug. So indications is just like talking about the use of the drug again. So for pain relief, you are using aspirin to alleviate mild to moderate pain. Okay. Such as headaches, muscle aches, toothaches, and the rest. Okay. Fever reduction. It is also effective in reducing fever. Okay. Anti-inflammatory action. It basically will prevent or stop inflammation. All right. Like you're having arthritis or any inflammation in the body at all. All right. Anticoagulant. So low dose aspirin is used to what? Prevent blood clots and reduce the risk of what? Heart attack and stroke. Right. What are the adverse effects? We have some gastrointestinal issues like what? Stomach ulcers because of its acidity. Okay. So since it is preventing blood clots, it can now tilt the patient into bleeding, especially when they have some wounds and all of that. It will be hard for bleeding to stop, all right? It could lead to irritation, or like then some allergic reactions like some individuals may experience what? Allergic reactions, including hives, swelling, and difficulties in breathing, okay? Bleeding. This is due to its anticoagulant properties. So from preventing blood clots, it can now tilt the patient into bleeding, you get? So aspirin can increase the risk of bleeding. Basically, if you have any wound and you're taking aspirin, it will be hard for clots to form. You get. So what are the contraindications when you shouldn't use aspirin? If the individual has an allergy to aspirin, so you actually take drug history when you're communicating with the patient, right? Individuals with a non-allergy to aspirin should avoid its use, right? The children with viral infections, aspirin should not be used in children with viral infection due to the risks of what? Reyes syndrome. Pregnancy and breastfeeding, use with caution only if the benefit outweighs the risks. Okay. So for the conclusion now, aspirin is a versatile medicine with a long history of use. Since when I was small, I've been hearing about aspirin. And right now, I'm talking about aspirin. What a pleasure. Alright. But it should be used with caution. And this is due to its potential side effects, which we have spoken about. Those are the adverse effects. So that's it for aspirin, also known as what? Acetylsalicylic acid. So even if you didn't take anything from this lecture, take the second name of what? Aspirin with you. And do return to watch, because most of these pharmacology videos, before they can stick, you have to watch them repeatedly like that. Okay, so that's it guys for the pharmacology of aspirin. See you guys.